All right, hi, I'm Abby Phelps. This is my second video going over PFTs, and in this video, we'll be going over interpretation of data. So your force vital capacity, so almost 80% of predicted or higher. So the slow vital capacity and force vital capacity should be compared if both are given. Patient with normal lung function will have values that are approximately the same for both volumes. If the slow vital or SVC is greater than the FVC, suspect obstructive lung disease. Excuse me. Patients with obstructive lung disease can exhale more air slowly than rapidly. And if the FVC is greater than the SVC, question the patient's effort on the slow vital capacity. An FVC below the lower limits of normal, even though the effort was normal, can be due to the following. So it could be airflow limitation, where air is trapped in the alveoli due to collapsing airways, and or is caused by a reduced driving force to decrease elasticity. And reduced lung size can caused by restrictive process. So for our force expiratory volume, your FEV1. So normal for this as well is 80% of predicted or higher. It is the volume of gas expired in the first second of the force vital capacity. So most individuals can exhale all of their air in about 2 seconds. A decreased FEV1 is a good indicator of obstructive lung disease. The FEV1 can be reduced as well because of limited airflow limitation or a restrictive process. And the FEV1 is used to determine the severity of a lung disease. So FEV1% is the best indicator of obstructive lung disease. If the FEV1 is decreased, but the FEV1 is normal, then the patient has restrictive disease only. FEV1 is expressed as a percentage. FEV1% serves as the key pulmonary function measurement to tell the difference between an obstructive disorder and a restrictive disorder. And then the normal for this is different. So normal is greater than or equal to 70% of predicted instead of the 80% like the other two. So for your obstructive values, so your TLC would be normal or increased, and in severe cases, it would be significantly increased. Your RV, your residual volume would be increased. Also, in severe cases, it would be significantly increased. And then for your FRC, that would be increased as well. And in severe cases, it would be significantly increased. So, what part of the pulmonary function test is utilized to determine severity? So for severity, we look at FEV1%. So, or FEV1, excuse me. So it can be greater than or equal to 80%, which is your normal, less than 80%, which is mild dysfunction, less than 70% moderate, less than 60% moderate/severe, and less than 50% severe. And then less than 35% is very severe. All right.